I'm John Kuruvilla. I'm a hematologist working at the Princess Margaret Cancer Centre in Toronto, Canada. I'm going to tell you a little bit about the KEYNOTE-204 randomized clinical trial, which is being presented at ASCO 2020. This was a large multi-center international phase 3 study in patients with relapsed or refractory Hodgkin's lymphoma that had had disease recurrence after autologous stem cell transplant, or were patients that were ineligible for autologous stem cell transplant. And the randomization was between an experimental arm of Pembrolizumab and the standard arm being brentuximab vedotin. So the primary endpoint of the study was progression-free survival. And the main result of the study was that the experimental arm of pembrolizumab showed a very statistically significant and clinically meaningful improvement in progression-free survival, with the pembrolizumab arm having a median progression-free survival of over 13 months compared to around 8 months for the brentuximab vedotin arm. In terms of the patient population, this trial included a number of different types of patients, so patients that had or had not had stem cell transplants, patients that were older, above the age of 60 versus younger, patients that had had more treatments. And so when you look at the hazard ratios for all of those various subgroups, including patients who were brentuximab naive, as there were a small number of patients that had received brentuximab in both arms of the study, the main treatment effect for progression-free survival was very significant in all of the subgroups that were analyzed. When you look at some of the secondary endpoints, it's a little too early to have looked at overall survival in this patient population. The response rates did look quite similar and were not statistically different between the two populations in the trial. When you look at toxicity in terms of endpoints, here we can see the other main difference between the two treatments in the study. We know a lot about the toxicities of both pembrolizumab and brentuximab given their common usage in hematology, and both drugs actually behaved as expected. The main toxicities with brentuximab were related to the chemotherapy in the antibody drug conjugate, and so things like peripheral neuropathy, which was generally quite manageable. In terms of pembrolizumab, the main toxicities that we saw were the typical immune-related side effects, such as hypothyroidism, which was easily managed. The one usual side effect we're a little more interested in hearing about with checkpoint inhibitors was pneumonitis. So this occurred in about a little over 10% of the patients. Half of those patients were grade 1, 2. The remaining patients, so about 5% or so, were grade 3, 4 in terms of toxicity. There were no deaths due to pneumonitis in that arm. Patients were generally managed quite effectively with corticosteroids and were able to be managed generally successfully with resolution in a majority of the patients. So when you look at the trial as a whole then, the conclusion is that the experimental arm pembrolizumab had a superior outcome in terms of progression-free survival and was quite tolerable. That benefit extended to all of the subgroups. It's a very meaningful clinical benefit in terms of 5 months median improvement over brentuximab, and thus pembrolizumab should be considered the new standard for this patient population.